Good afternoon, everyone, and welcome to the Leadership Development Group's webinar entitled Healthcare in 2018, ACA, Single Payer, Free Market, All in Play, being presented by Dr. Kent Bottles. My name is Lisa Clark, and I am the Director of Operations and Coaching at the Leadership Development Group. Just a few quick notes before we get started. Please note that all attendees are on mute for the duration of the webinar. Dr. Bottles will be taking questions in the middle of the presentation, as well as at the conclusion. Please feel free to submit your queries via the questions box on your GoToWebinar control panel, and I will present them to Dr. Bottles at the appropriate time. This webinar will be recorded, and we will be providing a link to the recording to all attendees. We appreciate your attendance and hope that you find this webinar valuable. I will now turn it over to my colleague, Tara Satlow, Director of Client Solutions at the Leadership Development Group, for a brief introduction. Tara?
Thank you, Lisa, and good afternoon, everyone. For those of you who may be new to TLD Group, I'd like to take this opportunity to introduce the firm and explain our mission and purpose. We are a global healthcare talent development firm. We work with leaders, teams, and organizations across the healthcare ecosystem, including providers, payers, and pharmaceutical companies, to enhance a leader's ability to execute strategy. TLD Group builds customized solutions with and for our clients, including results-oriented leadership assessment and coaching, high-performance team development initiatives, strategic succession planning programs, and executive physician and group leadership academies, including our Applied Physician Leadership Academy, or APLA, and our Applied Collaborative Leadership Academy, ACLA. Our academies are designed to engage and empower leaders, dyads, triads, and teams to take on the leadership challenges facing their organizations, their sectors, and their industry. Our worldwide faculty of over 200 organizational development practitioners, academicians, coaches, and consultants with deep expertise across the healthcare industry enables us to offer targeted insights and deliver highly impactful results. As part of our commitment to the healthcare industry, we are proud to introduce our Health Ecosystem Leadership Model, or HELM, built through our survey research with and consulting expertise within the payer, provider, and pharmaceutical sectors. Our model focuses on the key capabilities leaders require to truly transform the health ecosystem by enabling cross-sector collaboration. So be sure to stay tuned in 2018 for the release of our book on this very topic. One last note about TLD Group: we have recently been certified as a Women's Business Enterprise. Our WBENC status represents our commitment and our client support of diversity and inclusion within the healthcare and consulting industries. Next slide, please. So now on to our featured speaker. Today, it's with great pleasure that I introduce our timely webinar on Healthcare in 2018, ACA, Single Payer, Free Market, All in Play, presented by our esteemed TLD Group colleague, Dr. Kent Bottles. Dr. Bottles is a TLD Group advisory board member for our APLA program and is instrumental in keeping us informed on key insights, trends, and development needs in the healthcare, insurer, and pharmaceutical marketplace, ensuring that our leadership academies are consistently evolving to meet the ever-changing needs of our clients. Dr. Bottles is also a highly sought-out member of TLD Group's Speakers Bureau, presenting on such hot topics as clinical integration, physician integration, policy and healthcare reform, physician engagement, and accountability. Our speakers provide keynote addresses, one-day seminars, multi-day board retreats, and conferences for hundreds of executives, helping to strengthen executive leadership behaviors to navigate healthcare reform and drive required change. Dr. Bottles received his BA in History from the University of California, Berkeley, his MD from Case Western Reserve University School of Medicine, and is board certified in anatomic pathology and cytopathology. And before I hand the mic over to Dr. Bottles, I'd like to remind you all to type your questions throughout his presentation. Lisa Clark, TLD Group's Director of Operations and Coaching, will facilitate the Q&A portion of today's webinar. So Kent, take it away.
Thank you, Tara. One of my favorite quotes is, "If you're not confused, you haven't been paying attention." Just this week, we're getting mixed messages on Medicaid and the ACA from both the voters and the administration. On Tuesday, Maine voters by nearly 20%, voted to expand Medicaid to cover about 80,000 people that live in Maine. The same week, Seema Verma, who heads up CMS, gave a speech saying she wants to decrease the number of people on Medicaid by allowing states to have waivers that require work requirements and drug testing. In Virginia, voters said that in exit polls that healthcare was the most important issue that determined their vote in the governor's race, and they voted Democrats up and down the ballot. The same week, Republican senators are whipping votes for the budget and also including that they want to abolish the individual mandate of the ACA. So you can see that right now we're getting mixed messages and it's a little bit confusing. But what we want to do today is try to give some clarity to what's going on in 2018 and beyond. So the agenda is to talk about the ACA, then talk about what President Trump is doing to the ACA, talk about what that means for 2018, and then the future of the ACA. It's important to remember that things weren't perfect before the ACA was passed. Cost is probably the biggest reason why the ACA was passed, because the Americans spend about $3 trillion on healthcare, which is about $10,000 per person in the United States, and that's about twice as much as our industrial countries in Europe. Quality is a problem. In rankings with comparing to other countries, we don't come in number one, although we do spend more money. Access has been a problem. As we know, the ACA has now given about 20 million Americans insurance. Financial hardships. Before the ACA was passed, the number one reason for personal bankruptcy was medical hardships, either for the patient or someone in their family. The Dartmouth Institute told us a lot about small area variations of cost and quality. We certainly know we have shortages of primary care physicians and mental health providers. And it's good to remember that the individual markets, which have gotten so much attention under the ACA, were expensive and uncertain before the ACA was passed. Now, most of you probably haven't read all 2,700 pages of the Affordable Care Act, but I have, and I can summarize it in just 4 words: no outcome, no income. And what that means is that the government, because it spends so much money on healthcare, wants to hold accountable both hospitals and doctors for what they call value. And that has 2 different components: clinical outcomes and cost. So no outcome, no income means that by changing from fee-for-service to value-based payment systems, the government wants to hold accountable doctors and hospitals to provide low-cost care and high quality. Now, one way to summarize the Affordable Care Act is this 3-legged stool, which I borrowed from Charles Gaba, who's an interesting person that's good to follow on Twitter. The 3-legged stool shows that the blue leg shows that with guaranteed issue and community rating, that healthcare insurance companies can no longer do medical underwriting, so that they can no longer charge more money for people that have pre-existing conditions. With essential health benefits, the ACA has provided for 10 essential health benefits, and insurance is available at different metal levels: the bronze, silver, and gold. The red leg on the stool is the open enrollment period and the shared responsibility of the individual mandate and employer mandates. The green leg are the advanced premium tax credits and the famous cost sharing reductions. We're going to come back to the cost sharing reductions again and again, because President Trump has just recently decided not to fund those for insurance companies. But the point that Charles Gaba was trying to make with this 3-legged stool was that if you shorten any part, the stool will wobble. If you remove any section, the stool will collapse. And I think it's even better to think about it as a Jenga. Here we have someone removing, let's say, the individual mandate from the bottom. And if you do that, the entire structure falls apart. This is one of the problems with why the Republicans were unable to repeal and replace Obamacare, because they wanted to retain the popular parts, that you could still have your children until age 26 on your insurance company, that even if you had pre-existing conditions, you could still get insurance. but they didn't like the individual mandate or Medicaid expansion. The problem is that the individual mandate and employer mandates provide the funds that allow us to have insurance for people with pre-existing conditions and to allow the other parts of the ACA that almost everybody likes. So that was one of the problems with trying to repeal and replace it. Now, the ACA had 10 essential health benefits that are listed here. Every insurance policy had to include ambulatory patient services, emergency room services, hospitalizations, maternity and newborn care, lab services, rehab, prescription drugs, mental health, prevention and wellness, and pediatric services. It turns out that this is very controversial. Republicans have said that having all insurance have to have all 10 essential benefits make the premiums too expensive. So one of their solutions for high premiums on the individual market has been we should allow insurance companies to have cheaper insurance that perhaps doesn't cover all 10 essential benefits. So we're going to talk about that in a little bit. We've said that one of the reasons why that the ACA passed was that healthcare just costs so much in the United States and that the government pays for over 50% of healthcare. And I always thought this was interesting. If consumer prices grew as fast as healthcare since 1945, a dozen eggs would cost $55, a dozen oranges would cost $134, and a gallon of milk would cost $48. Last week, I bought 2 dozen eggs at Costco and it cost me $3.80. So you can see that a dozen eggs don't cost $55 and that healthcare prices have really grown much faster than inflation and much faster than people's salaries have kept up. This slide reminds us that really almost the entire United States economy is producing the same volume of goods and services with many fewer workers. And yet healthcare between 2007 and 2011, the healthcare system added 1.1 million workers despite declining admissions and office visit volumes. This is really important because this really isn't sustainable. And it shows that even though healthcare has been a really vibrant part of our economy, it's hard to say that it's going to continue to add more workers with declining admissions and office visits. Now, this is a slide that I use a lot when I do leadership retreats and I do strategic planning retreats. And basically, one of the few things that Republicans and Democrats agree on is that in order to decrease the cost of healthcare, we have to change from fee-for-service, which is that first curve, number 1, to value-based payments, which is the second curve, number 2. So there's really not a lot of arguments about this on both the left and the right. Now, fee-for-service is what most of us are used to, where every time you do a test or have a visit or do a CT scan or a surgery, you generate a fee. Quality is not rewarded. You're paying for volume. Fragmented care works. Acute hospitals are able to survive, and standalone providers and small groups do just fine. Now, if you go to value-based payments, what we're saying is that you want to have a prospective payment to cover a defined group of people. Now, that's why you hear about population health so much. And in this kind of value-based payment, continuity of care is required. You have to have systems of care. Providers become at risk for payments. You have to have electronic medical records, so it's IT-centric. And physician alignment usually refers to physicians becoming more and more not in small groups, but being employed by large systems. And we're seeing this all over the country. The problem for most of us is that we're caught in the straddle. The straddle is the middle, and that's where still you're getting much of your income from fee-for-service, and yet you know that accountable care organizations and value-based payments are coming down the pike. And what you have is that revenue drops, you don't get rewarded for quality, volume decreases, there's no decisive payment changes, pay for volume continues, it costs a lot to have electronic medical records, and physicians aren't sure what to do. One way to summarize this is to think about hospitals. In a hospital under the first curve under fee-for-service, which most of us are used to, you want your hospital filled to the brim, doing as many surgeries, lab tests, and CT scans as possible, because you get paid for every single one. On the second curve, in a value-based payment system, which we're going toward, you really want your hospital empty because you want to have prevention. Because every time you do a hospitalization or an ER visit or a CT scan, you're taking money away from the accountable care organization, and that's all the money it has. You get paid up front. So this is really a big, big difference, and it's good to remember, even though we're not going to talk about MACRA and MIPS, that's a separate law from the ACA. And even if the Republicans were able to abolish the ACA, MACRA and MIPS would stay in place, and that's really pushing people toward this second curve. So it's important also to remember how Americans are currently covered. About half of us get our insurance at our place of work, employer-based insurance. And the non-group individual market, which we hear so much about, this is the market that some people are saying is in a death spiral, is only 7%, because Medicaid covers 20% of Americans and Medicare 14%. When you translate these percentages into numbers, it's quite clear that over 156 million Americans get their insurance at work. 74 million Americans get their insurance from Medicaid and CHIP. And it's important to note that CHIP has actually not been reauthorized by Congress, so we've really got a problem there. 55 million Americans get their health care insurance from Medicare, and only 17.5 million get their health care from the non-group individual market. Now, this non-group individual market is where people get their insurances on the exchanges under the Affordable Care Act, and it's the one that you hear about the premiums going up so much and becoming unaffordable. However, it's important to recognize that not all 17.5 million Americans who get their insurance on the individual market actually see increased premiums. About 10.8 million are unaffected by premiums because they qualify for those federal subsidies we talked about when we showed the picture of the stool. So 10 million Americans get subsidies, and it's 6.7 million Americans who make a little bit too much money to qualify for subsidies or for the CSR payments that are going to be impacted by the increased premiums. So let's just try to keep that in mind, because it gets kind of complicated. But most Americans are not affected by the non-group individual market, the exchanges under Obamacare. Now, this is an important slide. The Kaiser Family Foundation is really good because they do a lot of surveys and they have a lot of white papers. But this one says that in August, more Americans said that President Trump's administration should try to make the ACA work than say they should make the ACA fail. And this is really a big change. Right now, 78% of Americans think that we should try to make the ACA work and not repeal it. 95% of Democrats believe that, 80% of independents, and even 52% of Republicans think that we should try to make the Affordable Care Act work, not fail. Now, that's a big change. And you might remember that in the midterm elections of 2010 and 2016, when the Republicans took over control of the House of Representatives, they were very critical of the ACA, and it was thought that that helped them to take over the House. What was interesting about the election this Tuesday was that Virginia voters said that healthcare was the most important issue that they voted on, and that they wanted the ACA to remain. So there's been a kind of a change that with time, the ACA has gone from being not very popular to now being at least more popular, and people want to see it work. There's a Reuters poll that just happened about a month ago, and it shows about the same thing. 62% of Americans want the ACA maintained and not repealed. 51% of Democrats want a bipartisan group to improve the Affordable Care Act. And even 56% of the Republicans want a bipartisan group to improve the Affordable Care Act. 56% were opposed to Trump's recent cutting off of those cost sharing reduction payments that we're going to talk about. And about 11% thought the ACA had already ended because of all the bad publicity about it. So there actually is a bipartisan bill that's been agreed upon between both the Republicans and the Democrats. Lamar Alexander's a Republican from Tennessee, and Patty Murray is a Democrat from Washington State, and they think that the CBO has estimated that a deficit reduction of $3.8 billion would occur over a decade. So we're trying to cut the cost of health care. If this bill was passed, it would cut it by $4 billion. The CBO, the Congressional Budget Office, also says that this bill would not kick anybody off of insurance, so the number of insured would stay unchanged. Now, they importantly say that there should be a 2-year restoration of these cost-sharing reductions that we're going to talk about, the ones that Trump has just eliminated. They want to provide states more flexibility with waivers. They want to restore the outreach funding for the Affordable Care Act. The Trump administration has actually cut the marketing and navigator budgets for the Affordable Care Act for the open enrollment period, which is happening right now. It started last week and it runs through December 15th. Now, this bipartisan bill has over 12 GOP senators in support and all of the Democrats, so it would actually get the 60 votes that it would need to avoid a filibuster. The problem is that Mitch McConnell, the head of the Senate, has not allowed this to come to a vote, and it looks like it's probably not going to pass. The only likelihood that it would pass would be that if it was added on to a big omnibus spending bill at the end of this year, and that's really uncertain. So we have our first polling question, which is about the bipartisan bill that we've just discussed.
So I've launched the poll question. Do you think the Alexander Murray bipartisan ACA fix bill will become law this year? Everyone will please register their votes. We'll wait a few seconds.
Yes or no?
Yes or no? Mm-hmm. Okay, I'm going to close the poll now, and you can see that 91% of the attendees believe that the bill will become, believe that it will not become law this year. So 91% have voted no, with 9% voting yes.
And I think that you're probably right. I probably agree with that estimation. So we now know what the ACA does, and we also know how to fix it or wreck it. This was an article in the New York Times. So if you wanted to wreck the ACA, you would do what Trump just did, cut off the cost-sharing subsidies we talked about. You would not enforce the individual mandate, which requires everyone to get insurance. You would not keep the website and outreach running smoothly. You would not take actions to decrease gaming the system. And you would cut off the funding for the departments like the computer departments that are important for the ACA. And these 10 essential health benefits that we talked about that all insurance under the ACA has to have, there's some discretion in how the head of HHS defines those health benefits. And you know that the Trump administration has actually defined the maternal health care part so that not contraceptions are not covered by everyone. Now, there also was a bipartisan ACA group that came together. Gail Walensky and Lanny Chain are healthcare experts who are very conservative, and Ron Pollack is a very liberal healthcare expert. And these folks said about the same things. They said that in order to fix the ACA and keep it vibrant, you should encourage all to sign up for coverage. You should allow states to experiment. You should ensure funding for the CHIP program, which actually has already expired on September 30th and has not been reauthorized by the Senate and the House of Representatives. This is a real problem. You should have judicious expansion of health savings accounts, and you had to fund the cost-sharing reduction subsidies because these are about $8 billion a year that help the insurance companies lower copays and deductibles for low-income Americans. The cost-sharing reductions are actually separate from the subsidies on taxes for low-income Americans. So this is how you would fix it or wreck the ACA. And I guess we should stop there and see if there's any questions about what the ACA does until we get into what the administration is doing to the ACA right now. So any questions?
Yes. Yes, we do have a few questions. The first question is, how will the budget process that is now ongoing in Congress affect healthcare?
It's really a great question. It's interesting because one WAG said that the Republicans' attempt to repeal and replace Obamacare was really a healthcare bill with it was really about hidden tax cuts. And now they're saying that the tax cut bill is really about hidden healthcare cuts. So if you look at the budget that was passed by the House of Representatives, it actually contained over $1 trillion in cuts to Medicaid and about $500 billion in cuts to Medicare. It also proposed that Medicare would be changed to a premium support, which would allow the federal government to sort of decrease the amount of support for Medicare. And then the other thing is that President Trump has been encouraging Congress, as part of their tax cuts, to actually get rid of the individual mandate, which requires everyone to have insurance. And that's a big deal because if you try to do that, then it really does undermine the ACA. So it looks like that even though Republicans have tried to move on because they failed to repeal and replace Obamacare, they're still trying to undermine it with the budget process. Another question?
Yes. The next question is, do you think that the ACA will be repealed by the GOP in 2018?
I don't think that they'll be able to. I know they want to, but if you think about it, the results from the Tuesday election are pretty stunning in the sense that Democrats did much better than they expected in Virginia, and they thought that health care was the #1 issue. It'll be very difficult for them to take a difficult vote, repealing and replacing Obamacare in 2018, because as we know, the Congressional Budget Office has said the ways they wanted to do it before would probably displace tens of millions of Americans from the health care insurance they already have. That would probably be suicidal if the Republicans want to continue to control the House of Representatives. You may not know, but there was all the delegates in the lower house in Virginia were up, and it looks like the Democrats gained 16 seats, which they really didn't expect to gain, mostly because of this health care issue. So I think Republicans will be reluctant to repeal and replace the Affordable Care Act in 2018 because they're facing midterm elections, and it looks like they're having trouble getting votes in the suburbs, at least if what happened on Tuesday is any indication. We'll talk about this a little bit more when we get into predictions for 2018. Any other questions?
Yeah, one last question. Someone wrote, employers are hit hard by the growing cost of employee health costs. Where are they weighing in on the ACA and reform?
Can you repeat that, please?
Sure. Employers are hit hard by the growing cost of employee health costs. Where are employers weighing in on the ACA and reform?
It's a good question, and we actually have some employer groups saying that they actually have come out opposed to the tax cuts that the Republicans are trying to say. Most employer groups actually have been saying, and we'll see a slide that says this, that they would like to see these cost-sharing reductions continued because they don't want to have instability and chaos in the individual market. So with that, let's go ahead and talk about what the administration is doing right now. As we've alluded to, President Trump for a while was continuing to pay these cost-saving reduction payments on a month-to-month basis. And then just recently he said they're going to cut them off. Now the CBO estimates that that move by cutting off the cost-sharing reduction payments, which I'm going to define in just a second, would actually increase the deficit by $194 billion over a decade. Now that's hard to understand. If the federal government pays less, why would it increase the deficit? And that's because they're tied to the subsidies. They have to increase the tax subsidies if they cut these off. Now, open enrollment declined by 4% in 2017. And part of that was that the Trump administration, which had just taken over, actually did not run television ads they'd already paid for. The problem is that a lot of people are now very uncertain about what's going on with the Affordable Care Act. And a Kaiser Family Foundation poll said that 85% of the uninsured don't even know when enrollment starts, and it started last week. So the other thing is that President Trump has been quoted at a cabinet meeting as saying it's dead, it's gone, it's no longer. You shouldn't even mention it. There is no such thing as Obamacare anymore. And obviously that's not true because the Affordable Care Act was not repealed by the Congress and is still the law of the land. Now, the problem is if fewer people enroll, then the risk pool gets worse. As you know, insurance works better if you have more and more people in it, so that the few people that do get sick can be subsidized by those that don't get sick. And the Trump administration has reduced the advertising budget for the open enrollment period from $100 million last year to $10 million this year. And some estimates are that that will decrease enrollment by at least $1 million for 2018. Now, so far, the first couple of days, enrollment has been very, very vigorous, which is surprising. It's actually the first day there was double enrollment compared to the first day last year. But the Trump administration has also cut the enrollment period from 12 weeks to 6 weeks, and they've actually said they're going to shut down the website every Sunday for maintenance, which was never done before. So we've got to talk a little bit about these cost-sharing reduction payments because they've been so much in the news. So basically, this is money in the Affordable Care Act for the federal government to send money to insurers of Silver Plan members to decrease their out-of-pocket costs for deductibles and copays and co-insurance. It's separate from the tax credit subsidy. This money is about $7 billion a year, and it affects the 6 million people on the ACA exchanges. Now, what happened was when Obama was still president, House Republicans sued the Obama administration, saying that this cost-sharing reduction was unconstitutional because of some unclear language in the law. They sued it in federal court, and most people didn't think that suit had much of a chance because usually federal courts say that arguments between the Congress and the president are arguments that are of a political nature and shouldn't go to the courts. People were surprised when the federal district court ruled in favor of the GOP, saying that they were unconstitutional. But the judge also said the payment should continue while Obama appealed the ruling. Now, this uncertainty about this $7-8 billion a year going to insurance companies has made the insurance companies very uncertain about how to set their rates. The Congressional Budget Office estimates that premiums would have to go up at least 20% if these payments aren't made from the federal government to the insurance companies. So Trump paid them on a month-to-month basis until just last month, when he said there's going to be no more insurance bailouts. So the Congressional Budget Office says, well, if you get rid of these subsidies, which are in the law, then premiums would increase by at least 20% in 2018 and even more, 25% in 2020. And as we said, it would increase the federal budget deficit by about $200 billion, which is not what you want to do. So doctors, hospitals, insurers, consumer groups, and even the U.S. Chamber of Commerce have all said you should pay these insurance subsidies. But what happened was that, like Senator Marco Rubio slipped a rider into some of the spending bills saying, let's not pay them. Now, then it gets complicated because some of the insurance companies are now suing the federal government saying, you have to pay us these. And a couple of federal judges have actually awarded insurance companies $214 million and $152 million saying they have to pay it. And there's 26 more lawsuits by insurance companies saying, wait, you promised us this money. Now, Republicans are saying it's a bailout of insurance companies. And Susan Collins, who's a Republican from Maine, said, when I hear them described as insurance company bailouts, that's just not an accurate description. Because they go to the insurance company, but the insurance company has to use that money to decrease the deductibles and copays for low-income people. And so the insurance companies now by law are required to lower the deductibles. They have to, even if they don't get the money from the federal government, they have to use the money, and they think that they should receive reimbursement for those costs. So Trump canceled these CSRs, these cost-sharing reduction payments just recently. Now, there was an unintended consequence, which is really in the weeds, but just stick with me and I think I can explain it. He halted the federal subsidies that are CSRs. He didn't halt the tax payments for low-income people. The subsidies, the tax payments for low-income people, are linked to the cost of the second cheapest silver plan. When silver premiums go up, subsidies go up. So what the insurance companies and the insurance state commissioners did was that for 2018, they really made this second cheapest silver plan go way, way, way up. And by doing that, subsidies went way, way up. So this covers the people that get subsidies, but not the people that earn so much money they don't get the tax credits. But what happened now, because they sort of did this end run around what Trump did, this one study says that there will be zero premium exchange plans in 2,600 counties. What that means is that people that get the tax credits will be able to get insurance for free. They won't have to pay any money out of pocket. So insurers are now going to are promoting this zero premium opportunity like crazy. So even though it looked like that by Trump's canceling the CSRs, it would really make premiums go skyrocket, they're not going to go skyrocket for people to get the subsidies. Since I live in Philadelphia, here's a Kaiser Family Foundation thing showing what I just explained. Because the subsidies, the premium tax credit amounts, are tied to how much a silver plan cost, in 2017, you can see here, the lowest bronze plan had $184 subsidy from a premium tax credit. Someone would have to pay $120 in the orange to get that. The silver, lowest cost silver would be $184 subsidy, and then out of pocket would be $190. For the gold plan would be $184 subsidy, $295. That's in 2017. Look what happens in 2018 in Philadelphia. For someone who's 40 years old with an income of $32,000, so they qualify for this, the subsidy. The subsidy's now gone up so much, $408, that you can get the lowest bronze plan and pay nothing out of pocket, zero. You can pay, to get a silver plan, you can only have to pay $58 out of pocket. To get the lowest cost gold plan, only $132. So what it looks like is, even though it looked like this was going to really affect premiums, it really doesn't affect people that get the premium tax credit amount. It only affects those who don't qualify because they make a little bit too much money. So this is a map that shows between 2017 and 2018 that the blue is the change in the lowest cost monthly premium for a 40-year-old with an income of $35,000. You can see that the change has gone down as much as 80%. However, if you go up to the highest part, it's about 31%. So what this means is that it's really interesting that for a 40-year-old with a $25,000 income, they have 1,500 counties where they'll be able to get a low-cost bronze plan and pay nothing out of pocket. And here we have here, which shows that for different income levels, we'll take the 40-year-old at top with a $25,000 income. The lowest cost bronze plan is down 75% from 2017. If you go to a 40-year-old who makes a little bit more money, $35,000 a year, the lowest cost bronze plan is down 39%. So what this means is that because the subsidies are linked to the second cheapest silver plan, the insurance companies and insurance commissioners kind of made a way that not everybody's going to get higher premiums. Now, Trump is also, as we said, trying to undermine Medicaid. It turns out that Republicans don't like Medicaid. As we said, 74 million people now get their health care through Medicaid, and about 31 states have expanded Medicaid under the ACA. 19 states didn't because they were controlled by Republicans. But what we now know is that Seema Verma, who runs CMS, now she's an interesting person. She's an expert in Medicaid, and she got her job at CMS because she had helped Mike Pence, when he was governor of Indiana, create Medicaid expansion in Indiana. So she is a big expert on Medicaid, and what she said in a couple speeches, one at the Cleveland Clinic and one just recently, was that she wants to give unprecedented levels of flexibility for states to change their Medicaid program. You'll remember that in almost all of the repeal Republican plans that didn't pass, What they wanted to do was have a block grant for Medicaid and cap the amount of money that can be spent on Medicaid. So what she doesn't really like able-bodied people getting Medicaid. She thinks that they should not be in private insurance markets. They shouldn't be dependent on public assistance. And she's been quoted as saying, we've put more than 10 million, 12 million people into this program by the ACA expansion, where the doctors won't see them and the policies that are in Medicaid programs are not designed for an able-bodied individual. In her speech this week, she actually called what the Obama administration had done by expanding Medicaid the soft bigotry of low expectations. So what she's saying is that she now wants to allow states to have a waiver that would allow people to require you to have work or even get drug tested in order to get Medicaid. Most Medicaid advocates don't like that because they think it would decrease the number of people on Medicaid. So the problem is that recently HHS, which now doesn't have a leader, remember Tom Price had to resign because he had taken too much expensive travel, they've been sending out mixed messages. They've approved some of these waivers for Hawaii, Alaska, Minnesota, and Oregon, but they really put a curveball to many of the states when they refused to support the Oklahoma and Iowa waiver examples. Oklahoma and Iowa were trying to really change the ACA in very conservative ways, and this rejection of these waivers has really created a huge lack of trust between state officials and HHS. Here's some details about the Oklahoma waiver, and here's some details about Iowa. Iowa really did a huge change that would be very conservative, and most people thought HHS would approve it, but there's a report in the Washington Post that President Trump actually called Seema Verma and said, don't approve it because I don't want to prop up the Affordable Care Act. And so what we have now is, it looks like that she's now saying that we want to decrease the number of people on Medicaid. As I think I mentioned in the beginning, that kind of goes contra to what you hear by looking at polls or what happened in Maine. So Maine did not expand Medicaid under the Affordable Care Act. They have a Republican governor who's very conservative. The Maine legislature actually passed 5 times to try to have Medicaid expansion for the 80 million people that live in Maine that would qualify. The Republican governor, LePage, rejected that. But on Tuesday, they had a referendum, and by 19 points, Maine people approved expanding Medicaid. So that's really kind of interesting that in the same week when Seema Verma is saying we want to cut down on Medicaid, when all of the Republican plans to repeal Obamacare got rid of the Medicaid expansion, you have voters saying we want to expand Medicaid. And when you look at the Kaiser Family Foundation approval ratings for Medicaid, right now overall 74% of Americans like Medicaid. Among Democrats, it's 84%. Among independent voters, it's 76%. And even among Republican voters, it's 61%. So again, this shows how difficult it is to take away insurance once you give it to people. Now, we've said there's been mixed messages because they did approve the Alaska waiver so that Alaska could get $323 million over 5 years to stabilize the one insurer who still writes insurance under the ACA in Alaska. Now, this just shows Medicaid and CHIP has grown tremendously, and we said 74 million Americans now get their insurance through Medicaid and CHIP. And 3 out of 5 nursing home residents are supported by Medicaid, 2 out of 5 people with disabilities, 2 in 5 children, and 1 in 2 low-income individuals. So Medicaid has really expanded, is quite popular, and yet Republicans really don't like it, mainly because of their budgetary problems. It's quite expensive, and it causes problems for both the federal and state budgets. So we've seen how that the GOP has done some changes to Medicaid and to what the ACA. We also know now that Seema Verma has come out in favor of changing Medicare. She wants the Innovation Center in CMS to give consumers more incentives to be cost conscious. It is true that Medicare is supposed to run out of money in about 12 years. And the 2018 House GOP budget proposal, which just got passed, includes a Medicaid premium support plan. This is Paul Ryan's favorite policy. This would change Medicare from an open-ended policy to premium support, where the government would pay a contribution towards your premium and the beneficiaries would have to pay the rest. The GOP thinks that this would use market signals to set the stipend levels. Now, the two crucial variables for this premium support are, how do you set the stipend levels for Medicare support, and how do the stipends grow over time? And in most cases, it looks like the policies, the stipend wouldn't grow over time as much as healthcare costs would grow, so that people would pay more and more for their Medicare. Now, if the stipend level grows more slowly than healthcare costs, people over time have to pay more out of pocket. If the stipend level grows at the same rate, then people would pay the same amount of their money. What Ryan would like to do is get people off of traditional Medicare and make people go to private Medicare Advantage. Although this is in the GOP budget that passed the House, this is very controversial, and I really don't think this is going to pass anytime soon. The CBO, again, the Congressional Budget Office, has taken a look at these various parts of Medicare premium support, and depending on how you set all these, setting the stipend or setting how much it will rise, the Medicare spending could fall by as much as 9% or as little as 0.5%. Now, obviously, the AARP and seniors would be worried about this, and they are worried about this. And here's one expert saying, traditional Medicare has been the leader in reforming the healthcare payment and delivery system to improve efficiency. It has outperformed private insurance in holding down the growth of healthcare costs, but its ability to continue to do so would shrink significantly if premium support caused its enrollment to dwindle. So again, what you see here is that Republicans would like to control the cost of Medicaid and Medicare. For Medicaid, they'd like to do block grants. For Medicare, they'd like to do premium support. There's not a lot of support right now for this to pass, but it's certainly something that they would like to achieve. So the other thing that Trump has been doing is saying, as we said, that the Affordable Care Act, Obamacare, is already dead. And he's also been putting out some executive orders. And on October 12th, which is just last month, he put an executive order that was instructing the Labor and also the Health Department and the IRS to come up with suggestions so association health plans could be sold across state lines. This has been one of the things that he's been for a lot, thinking that by selling insurance across state lines, it would control costs. He also, in the executive order, said that he wanted to expand health insurance savings accounts and also allow people to buy short-term non-ACA compliant insurance up to 1 year. So the order asked the Labor, Health, and Treasury departments to submit ideas about how to accomplish these goals. This executive order can't make this happen. They now have to come back with ways to make this happen. And so what you see, this would actually undermine the essential health benefits that are in the ACA compliant plans. And one of the problems is these association health plans have been tried in the past, and they've had some problems. Even though Trump and Rand Paul is a big supporter of these allow small groups of, say, car dealers or churches to band together to get insurance plans. The problem has been that there's been dozens of court cases and enforcement actions against these plans. The Labor Department has targeted unscrupulous promoters who sell the promise of inexpensive health benefit insurance but default on their obligations. The problem is that a lot of times these small associations don't have the capital, don't have the money to back up the claims that come in. So there was a Washington State Association health plan for 300 small employers that had charged $3 million in excessive fees and got into trouble with the government. There was a Florida case that left $3.6 million in unpaid claims because the small association plan didn't have the capital to back it up. There was a New Jersey plan that was aggressively marketed but inadequately funded that left $7 million in unpaid claims. One Florida man was sentenced to 57 months in prison for embezzling $700,000 in premiums for an association health plan for several churches. And Louisiana, 2 people pled guilty to conspiracy by using the money from trade association plans to pay for spa treatments, diamond cufflinks, evening gowns, and foreign travel. So the problem with these association health plans is that they don't require all the 10 essential health benefits. And in the past, they have been troublesome because the small associations haven't had enough money to pay all of the insurance that comes out. So this is one of the problems that people talk about when you talk about association health plans and the non-compliant ACA plans. It is true that the 10 essential benefits that we reviewed in the beginning that are required for all ACA health insurance do tend to cause the premiums to go up. Now, there are tax subsidies and CSRs to defray those costs, but if you don't qualify for those, then premiums do go up, and we'll see that premiums are going to go up in 2018. The problem is if you sell insurance that doesn't have all 10 essential benefits, you often end up having people that have insurance that, for example, doesn't cover hospitalization or doesn't cover lab work. And so when people then need to be covered, they find out that the insurance that they have really isn't as useful as they thought it was. Now, this idea of selling across state lines is actually available now, but has really not been very successful in lowering healthcare costs. And the problems are the barriers to entry are not regulatory, they're financial and network development. So most insurance companies are not supportive of this. And the reason is that even though I live in Pennsylvania, so healthcare insurance may be cheaper in Delaware or in New Jersey, but if I am able to buy an insurance in Pennsylvania, a really cheap Delaware plan, it probably is not going to include any doctors in Pennsylvania. And so here, this healthcare expert from the Institute for Policy Innovation has said, I've tried for 10 years to explain this to Republicans. It's a big problem. Just because a good affordable policy is available in another state doesn't mean I would be able to get the network of physicians and the good prices that are available in that other state. So even though this is a favorite of Republicans, most people think it probably won't work very well in order to decrease healthcare costs. So basically, that's where we're at. And so insurers were very uncertain about 2018. They were worried about these no CSR payments that for a while were being paid month to month by the Trump administration. And the insurance companies going through their plans said, if we don't get the CSR payments, we're going to have to increase our premiums by 13 to 20%. If there's no individual mandate, if perhaps they get rid of that in the budget, in the tax proposals, which is what the GOP senators are thinking about right now, that would require insurance companies, say, increase of 2.5 to 23%. Because if you don't have the individual mandate, fewer people will have insurance. If you have fewer people with insurance, then premiums will go up because you have fewer healthy people to subsidize people that do get sick. If the health insurance tax remains, then that's a 3% increase. So Larry Levitt of the Kaiser Family Foundation has said in most of the country, the market would be stable if not for significant uncertainty about what the Trump administration will do. The insurance companies had to set their rates, not really knowing, they still don't know, whether or not the individual mandate will be enforced, whether or not the CSR payments will be paid. Right now, they're not going to be paid. So that made it quite unsure about how they should set rates. Now, just recently, HHS has put out a report on 2018. So the number of insurers did drop to 132, and it was 167. And that drop is mostly because of uncertainty based on insurers not really knowing what the rules would be. Even though you hear Paul Ryan and President Trump saying that the Obamacare has been in a death spiral, it really isn't true. The Kaiser Family Foundation has had a study which showed that insurance companies in 2017, in the first half part of 2017, were actually making a profit. And we have some other statistics to show that the individual market was actually stabilizing until all of this uncertainty was introduced by the Trump administration. So going in 2018, every county in the United States will have at least one insurer, but 30% of consumers will only have one insurer. Now, that was something that for a while it looked like there would be counties in Tennessee, counties in Iowa, a few counties in Ohio that wouldn't have any insurers because people were dropping out. You probably heard that the Blue Cross of Iowa dropped out of all of the counties in Iowa, and it was only when Medica came in that they now have insurers. So for a while it looked like there would be places with no marketplace insurers, but now all the counties in the United States have insurers. Premiums for consumers without subsidies, without those tax credits, will rise by about 37% in 2018. Now, that's thought to be due to Trump cutting off the CSR payments and the uncertainty around the individual mandate. The federal government will actually spend more because the value of the tax credits will rise. That's what we talked about, because they increased the silver premium so much that tax credits are up. So the federal government is going to pay more money whether they pay the CSRs or not. Here's the map for 2018, which shows in the yellow counties that have only one insurer, and then in the dark green that counties have more than 3 insurers. So there's 0 counties projected to have 0 carriers, and that was part of the reason why Paul Ryan was saying that the Obamacare was imploding, which it isn't. 1,500 counties would have only 1 carrier, which is not ideal. You'd like to have competition. But 2.6 million exchange participants would be in a county with only 1 insurer. But every county has at least 1 insurer. So that's better than having counties without any insurer. Now, just last week, Standard & Poor's took a look at all this and said, insurer exits, higher than expected premium rate hikes, a series of cost sharing reductions, those CSR subsidies that Trump cut off, an executive order on health care, which we're going to discuss, and a recent discussion about a short-term bipartisan fix, that's that Alexander Murray bill we talked about, have all contributed to uncertainty that's been brewing lately. So basically, because of so much uncertainty, because people don't even know when the healthcare enrollment starts, because the healthcare enrollment's been cut in half, because there's less marketing, there's less money for navigators, who are the people that help people sign up. S&P estimates that there'll be 7 to 13% lower enrollment in 2018 than there was in 2017. Now, lower enrollment is bad for the Affordable Care Act. It's bad for all of us because it means that there's fewer people in the risk pool to help subsidize people that do get sick. So Standard & Poor's last week was saying that they expect 10.6 million to 11.4 million to sign up for these Affordable Care Act insurance individual markets, even though it looks like that people with tax subsidies will be able to get a low-cost bronze plan with no out-of-pocket payment. Now, this is a Kaiser Family Foundation poll, which shows that because of all this uncertainty, because of the publicity around Congress saying they were going to repeal and replace Obamacare, and because of President Trump saying it no longer exists, a lot of people are confused. If you look here on the uninsured, which is the first bar up there, between ages 18 and 64, 68% of the uninsured who should be signing up don't even know that enrollment's already started on November 1st. They don't know when it's going to happen. And 81% don't know when it ends. For most people, it ends December 15th. A couple of the states that are running their own exchanges have actually expanded that, but for everyone on the federal exchanges, the enrollment period's been cut in half. It stops on December 15th. But if people don't even know when it starts or stops, and if there's no marketing being done and no navigators to help them sign up, then enrollment probably is going to be depressed, even though it looks like enrollment for the first couple days has been very robust. So this is important because this is some of the confusion out there among people who should be signing up to get health care. Now, what's been interesting is a lot of advocates were not happy with the Trump administration for not funding the marketing and for not funding the navigators, for cutting the enrollment period in half. And they worried that this, what they're calling sabotage, would decrease the enrollment numbers. And as we've said, low enrollment numbers equal higher premiums and fewer insurers. And as someone who Get America Covered is a group that's trying to get people to sign up, we can never make up for what I believe is the government abdicating its responsibility. There is such a high level of confusion out there. Nobody knows when open enrollment starts. Now, but what's happened is that open enrollment, the first year it was available, 8 million people signed up. And that, you might remember, was when the website didn't work very well. There was a lot of confusion. But in the second year, 11.6 million people signed up. In the third year, 12.6 million people signed up. And in the fourth year, which was 2017, it went down a little bit. 12.2 million people signed up. Most people attribute that going down was that when Trump took over the White House in January, HHS stopped advertising and stopped having people be navigators to help people sign up. You may remember that under Obama, there was a lot of HHS, over $100 million spent on advertising to get people signed up. You might remember that President Obama himself went on a comedy show, Between Two Ferns, which was trying to get younger millennial people to sign up. So if you don't let people know when open enrollment is, you're probably going to have a decrease. Now, one of the things these advocates have been doing, though, is that many people, and Andy Slavitt is someone you might recognize the name. He ran CMS under Obama, was the acting administrator under Obama. And since he's no longer the administrator, Seema Verma is the administrator now, he has really been spending almost full time tweeting every day. And if you want to follow what's going on in healthcare, following Andy Slavitt on Twitter is a good way to do it. But he has really been going all out trying to make up for the lack of marketing under Trump. Now, California is going to spend $111 million on marketing. The message is, according to Peter Lee, who runs Covered California, we're here for the long haul. If we don't reinforce that for people, they're less likely to sign up. And California has actually extended the enrollment because they run their own exchange beyond the December 15th deadline for most of the states. So basically, that's what's going on. What will happen? So there's only a few things that could happen. The GOP could finally repeal and replace the Affordable Care Act next year in 2018. I've already said I don't think that's going to happen because, especially after the Virginia vote, I don't think that anyone in the House or the Senate is going to want to take a very tough vote that knocks off 10 to 20 million people from insurance that they have when they have to face the midterm elections in 2018. Usually what happens before midterm elections is the House and the Senate don't get much done because they're focused on getting reelected. Now, I do want to mention that it is true that in the wave election of 2010 and 2016, when Republicans did take over the House, they used criticism of the Affordable Care Act as one of the ways that they took over the House. So what usually happens, according to history, is whenever someone like a Republican gets elected to the White House, there's usually some loss of Republican seats in the midterm election. So with now healthcare being more popular and people enjoying having insurance, it's hard. I think it's hard to see how they finally repeal and replace the ACA in 2018. The next thing that could happen is the Trump administration undermines the ACA, and certainly by cutting off the cost-sharing reduction payments, by not advertising, by not having a permanent head of HHS, that certainly seems to be happening. You could have a bipartisan Alexander Murray congressional bill that fixes and strengthens the ACA. In that bipartisan bill, there's actually money to encourage people to sign up, although it probably will be too late by the time if it passes. And then the last idea that could happen is the Trump administration could say, well, it's our duty to implement the ACA, so even though we don't agree with it, we're going to implement it and make it work, which is what it looks like the American people want them to do. So with that, we have our second polling question is, what do you think is going to happen?
Okay, I have launched the poll. What will happen to the ACA in 2018? We'll give everyone a few seconds to answer.
Just pick one of those choices.
Okay, I'm going to close the poll. And it appears that 76% of the attendees believe that Trump will undermine the law, and 24% believe that Congress will fix the law.
Great. So now that we know what's going on, we kind of understand what's happened in 2017, what's happened in 2018. Let's go back to 100,000 feet and really take a look at, now that the dust is kind of settled and we don't think that there's going to be major congressional action anytime soon, what do progressives want and what do conservatives want? Progressives seem to be more together on what they want. It looks like that the Democratic Party and progressives want to protect the Affordable Care Act, although many of them don't think it goes far enough and would like to have Medicare or Medicaid for all. And it looks like progressives really do want to extend health coverage to almost all or all Americans. Now, what they don't agree on is how to do that. You probably know that Bernie Sanders, the independent senator from Vermont, has proposed a bill that actually has gotten more co-sponsors than ever before for Medicare for all. The senator from Hawaii has actually proposed a bill that would have Medicaid for all. Another group has said that there should be midlife Medicare, which would open up Medicare to people ages 50 to 64 years old, which is younger than you can apply for it now. So it looks like the progressives want to protect the Affordable Care Act, but also would like to kind of extend that and actually get to Medicare or Medicaid for all. Now, the problem with that is that there's the cautionary tale of Vermont's failed Green Mountain Care. Now, as you know, Senator Sanders is from Vermont, and in Vermont, which I guess has a liberal governor and more Democrats than Republicans in the state legislature, they actually tried to do a Medicare for all in Vermont called Green Mountain Care. They couldn't get it passed even though everyone was for it, and the reason they couldn't get it passed was how much it cost. Interestingly enough, there was a referendum in Colorado last year with a similar approach that was voted down because of cost. So it looks like progressives would like to get everyone covered. Many of them would like to have Medicare for all, but without the money for that, they at least want to protect the Affordable Care Act. What do conservatives want? Well, the conservatives have never liked the Affordable Care Act. And it's interesting because health care is really a Democratic issue. Republicans have never been that interested in health care. It's not a main issue. Their main issue is cutting taxes. And so one of the reasons that you have the conservatives wanting to limit the role of government in health care is that they don't believe the government should really have much to do with health care. And that was one of the things that contributed to their inability to repeal and replace the Affordable Care Act. They didn't have the staff who knew how to make the compromises or draft the bills that could get 50 votes in the Senate. So one of the reasons that it's uncertain that they can repeal and replace the Affordable Care Act is they really don't have a lot of expertise on healthcare. If you look at the so-called healthcare experts on the right, Michael Cannon of the Cato Institute still says we have to repeal the Affordable Care Act. We've run on it for 7 years. We've promised we would do it. We voted over 50 times in the House to repeal it, and yet we still couldn't get it done. Why? Mostly because it's hard to throw 20 million people off of healthcare. Now, Avik Roy, who's at the Foundation for Research on Equal Opportunity, is another expert. He would like to go to a Swiss system, which would have universal coverage through private insurance, but no individual mandate. Doug Holtz-Eaton, who was McCain's main advisor on healthcare, says, let's just change the delivery system to decrease cost and leave health insurance alone. Ted Cruz of Texas has said, let's let insurers sell a lot of non-ACA compliant plans. That would bring down the cost of healthcare, even though then the healthcare insurance that people had might not cover labs, might not cover birth control, might not cover hospitalizations, would be very stripped down plans. So that's why those 10 essential health benefits are so important in the Affordable Care Act. So it's pretty clear what progressives want. It's pretty clear that what conservatives want. The problem is that once you give an entitlement like healthcare insurance or Social Security, it's increasingly difficult to get rid of it. With all of the plans that the House passed and that the Republicans in the Senate couldn't pass, it turned out that many Republican governors, like John Kasich of Ohio, who had increased Medicaid expansion, did not want to support the GOP repeal, because then the states would be stuck with, how do we cover all these people that have Medicaid? And with the people in Maine voting for it, and now it looks like there's going to be a referendum in Utah, which the voters will decide whether they want to expand Medicaid under the ACA. It looks like, at least for now, there's a lot of support for Medicaid and for having coverage. So polling question 3.
Okay. Do you think Medicare for all will pass in the next 10 years? Yes or no? So we are waiting for some responses. Give it a few more seconds.
So will Bernie Sanders get what he wants?
All right, I'm going to close the poll now. And it appears that 70% believe that Medicare for all will not pass in the next 10 years. 30% believe yes. So
interesting. So we've talked about that. There was an interesting article by Ezra Klein, and Vox, vox.com, is a good place to get lots and lots of updates on healthcare. Just before we talk about this, Kaiser Family Foundation, vox.com, following Andy Slavic or following me, Kent Bottles, on Twitter. These are ways that you can get all of the stuff. But actually, I read the New York Times and the Wall Street Journal every day, and almost everything that we're talking about from the right is in the Wall Street Journal, and from the left is in the New York Times and the Washington Post. So there are pretty good ways to stay up on all this if you want to get more into the weeds. Ezra Klein, who is the editor of Vox, said that there's a problem on healthcare, and we've already mentioned it in a way. Healthcare is not a main Republican issue. They're not that interested in it, and they really don't have a lot of expertise in healthcare. And what Klein has called conservatives' real versus fake position. And this conservative New York intellectual is really the real position of conservatives is this quotation here. If Republicans cannot defend the idea that what is important is the freedom of the individual to make choices about how to live his life, as opposed to the notion that we're all in this together and we must all participate in healthcare to balance each other's healthcare outcomes, then we've accepted an essential social democratic principle, and that's a huge concession. What he's saying is the federal government should have nothing to do with healthcare, and the very idea of how healthcare insurance works is anathema to a true conservative, that people should have the freedom to not have to have healthcare, even though the larger the risk pool you have, the better healthcare works. So what they're saying is, and you hear Paul Ryan say this, people should have the freedom not to have healthcare. That's why they're against the individual mandate. And they're still thinking about putting it into the tax plan, the tax cut plan, is that if you make everybody have healthcare, that makes healthcare insurance work. Because go back to that Jenga slide. There's things that you like making everybody with pre-existing conditions be able to afford healthcare, but you really can't afford that unless you have an individual mandate. So the individual mandate, even though it's against conservative principles, is what allows you to have the revenue to cover everybody. So what Ezra Klein's saying is that their fake position is, yeah, we really don't want to take healthcare insurance away from people, but true conservatives don't believe in the federal government having a role in health insurance because freedom to do whatever you want is more important. And this gets to kind of what we all end up, when I go around the country and talk, I'll say, is healthcare a right? And usually most people will say yes, a few people will say no. And obviously, if you believe in healthcare insurance and if you want everyone covered, then you're saying healthcare is a right. But Atul Gawande, the famous Harvard surgeon who's written the influential articles in the New Yorker, just last month wrote an article entitled "Is Healthcare a Right?" And what he did is he went back to where he grew up in Appalachia, in Athens, Ohio. And he clearly is has a master's of public health, is a liberal, and thinks that healthcare is a right. But in returning to where he grew up, he really delved more into what does it mean that healthcare is a right? A right makes no distinction between deserving and undeserving. And when he talked to people he went to high school with in Athens, Ohio, he said in Athens, Ohio, self-reliance is really, really important. And so a lot of his friends said, I know so many folks on Medicaid that just don't work, they're lazy. And so they don't think healthcare is a right. And yet people think that Medicare is a right because they say, well, we all pay in for that and we all benefit. So they like Medicare. They don't want anybody to take that away from them. But they don't think that everyone should be on Medicaid if they're lazy. So one of his friends from high school said, I think the goal should be security, not just financial security, but mental security, knowing that no matter how bad things get, this shouldn't be what you worry about, healthcare. We don't worry about the fire department, the police. We don't worry about the roads we travel on. It's not like here's the traffic lane for the ones who did well and saved money, and you poor people, you drive over here. So this friend was saying, I think healthcare is a right. Many of his friends were saying, we don't think healthcare is a right because Medicaid, we know people on Medicaid that are lazy and don't work. Mm-hmm. So the next polling question is number 4.
Yes, is healthcare a right? Yes or no? We'd like your feedback. Give it a few more seconds. Okay. And it seems that 82% of people believe that it is indeed a right, with 18% saying no.
And that really is interesting because that kind of shows you the split between people that support the ACA and people that don't. And so, but I think what Atul Gawande does by visiting Appalachia where he grew up kind of makes it more, it's not just an absolute. So what he says, we want to reward work, ingenuity, self-reliance. We also want to protect the weak and the vulnerable, not the least because over time we all become weak. Finding the balance is not a matter of achieving policy perfection. Whatever program we devise, some people will put in more and some people will take out more. Progress ultimately depends on whether we can build and sustain the belief that collective action genuinely results in collective benefit. And so there's actually a philosopher who says that rights are not the near absolute requirement that we can demand. Rights are about both duties and freedom. There's cost and trade-offs when you have rights. And really the controversy is really how much aid and protection a society should provide, given the cost is ultimately a complex choice for democracies. So we've really covered the waterfront, but let's look forward. The ACA in 2020. And Sarah Cliff, who also works at Vox.com, which is a good place to get information, actually asked a whole bunch of experts what they think will happen in a couple of years. They think that there will be some non-compliant short-term insurances with minimum coverage. So the 10 essential benefits of the ACA will be eroded. And what that will happen is higher premiums for younger and healthy people and higher premiums for those that don't get the tax credit subsidies. They're going to probably leave the ACA marketplace. Most experts believe Trump will try to undermine but not entirely destroy the ACA. And when you look at this, many people think that there's a chance that either the Democrats will take the House of Representatives in 2018 or at least very much narrow the gap between Republicans and Democrats, which will make it harder and harder for anyone to totally repeal the ACA. Remember, the health plans and insurance commissioners were able to respond to the cost-sharing reduction termination by Trump and create lower prices and better coverage for subsidized consumers. I mean, it's a real surprise, but people that are under the tax credit subsidies under Obamacare will be able to get a low-cost bronze plan and pay nothing because the subsidies have gone up so much. They don't think insurers will exit the ACA in 2020 because they can always raise premiums, subsidized consumers will be covered, and the federal taxpayer will have to support the higher premiums. A recent article in the LA Times just last week really shocked me and many people that follow this. It turns out that insurers are not going to exit the ACA. They're not going to implode. It turns out that HealthNet, the largest Medicaid insurer nationwide, raked in $1.1 billion in profit from 2014 to 2016. That Anthem turned a profit of $549 million in just the California Medicaid program. Overall, Medicaid insurers in the Golden State made $5.4 billion in profits from 2014 to 2016. So insurers know how to now, they've gotten some experience, they now know how to do risk. They're not going to exit the ACA, and that showed up because in 2018, there's not a single county in America where insurers are not available. And that's because insurance companies actually are making money on this, and they're not going to just exit the market. As one person said, it's tough to deal with an unreliable partner if you're an insurance company, the unreliable partner being the Trump administration. But insurance companies know how to price risk. They know how to price a bad market. Given the subsidy structure of the ACA, there's a very strong incentive for every county to have at least one insurer. And if you look at the money they're making in California on Medicaid, you know darn sure they're not going to exit the market. So what the prediction is that healthier middle-class people will leave the ACA, which will increase premiums even more. Older middle-class people who need insurance but don't qualify for assistance will be hurt the most. Patients with health problems will not be attracted to these skimpier, non-compliant ACA plans and will have trouble buying any insurance on the exchanges, and many Trump voters will be harmed. And 15 million people are buying ACA compliant coverage in 2017. Of those, remember, 8.7 million are covered by subsidies and will actually pay less for insurance in 2018 than they did in 2017. It's the 6 million people who are not covered by the tax credits that will exit the ACA and who will be hurt. Only those unsubsidized consumers who have health problems will stay in the ACA and pay the higher premiums. But what's interesting is that for the first time, you see some people saying, disagreeing with our poll, that some people think that actually we're getting closer and closer to a single payer system. That if you did repeal the ACA, that might pave the way for single payer. Most people don't recognize that a third of Americans already get single payer. They're on Medicare, Medicaid, the military, or VA coverage. And what's interesting is Mark Bertolini is the CEO of Aetna, and he recently, in a town hall at Aetna, said that for the first time, he really does not like single payer, but he thinks that we should debate the issue, and he would agree with Avik Roy. He'd like to go to a Germany or Swiss kind of thing where the government contracts with private insurers, obviously, because he's a private insurer, to provide a standardized set of benefits. I thought this was interesting, and we can close with this. Richard Hanna is one of the recently retired GOP congressmen. He retired at the end of 2017. And even though he hates the ACA, I think that what he said before they attempted to repeal and replace the ACA was interesting. He said, remember, this is a Republican congressman, the ACA will in some form survive and the millions of people who are on it will have insurance. Politically, it's untenable to just wipe it away. At the end of the day, we'll have some sort of national health care that's going to look very similar to what we have now. And that's mainly because it's very difficult to take away insurance from 20 million people. So what happens next is the ACA remains the law of the land. The Trump administration must implement and manage it. They're probably going to try to undermine it. And the big thing is that healthcare organizations have to learn how to respond to this mixed message. They're still going to have to deal with MACRA and MIPS. We're still going to go from fee-for-service to value-based payments. It's just going to be chaotic and rocky, and there'll be starts and stops. with that, let's just wrap it up and see if there's any questions.
Yes, we have a couple of questions. One question is, since the ACA is still the law of the land, wouldn't Trump be in violation of the law by arbitrarily changing elements of it without new legislation?
Yes. It's actually, it turns out that when he says things like there's no such thing as Obamacare anymore, it looks like that appears to violate the president's legal obligation under Article 2 of the United States Constitution, which is to take care that the laws be faithfully executed. And so some experts have actually opined that he is breaking that law. And how that's going to play out, I think, is very uncertain. Next question.
Yeah. Why are the Republicans against the 10 essential health benefits in the ACA?
I think that they're against them because it's ordering people to have insurance and it raises premiums. If you go back to that quote by the intellectual, basically, if you're a very conservative person, you want limited government, you want the government not to be able to order you to do things. And that was the basis of one of the lawsuits against the ACA. Remember, the Supreme Court, they were hoping would say that the individual mandate requiring everyone to get insurance was unconstitutional. And Chief Justice Roberts said, no, that we can tax people with the IRS, we can also make them have insurance. But basically, it's a freedom kind of thing, is that if you're for limited government, you don't want the government telling you what to do.
Okay, thank you. Another question. How does the removal of Tom Price from the HHS affect us in 2018?
It affects us a lot because right now there's no big leader at the HHS. There's an acting leader, but Seema Verma is permanent at CMS. But when you don't have a leader, you get mixed messages. And that's what many people, insurance companies, medical groups, a lot of the integrated delivery systems I work with, are getting mixed messages out of HHS. And I think we see that already. For example, they approved the Alaska waiver, which we would be expected. They did not approve the Iowa waiver, which was a very conservative waiver. So without permanent leadership at HHS, you have a vacuum where people aren't sure what they really stand for. So until we get, and I have not heard that Trump has nominated anyone to be the leader of HHS, it really makes a fifth of the economy leaderless, which is a big problem because they don't give us clarity in terms of what waivers they're going to approve or how they're going to change MACRA and MIPS. It's a big problem. And as you recall, Dr. Price was a congressman from Georgia, an orthopedic surgeon, who is very conservative, but got into trouble because he took a lot of expensive travel at taxpayer expense.
Okay. How do Republicans want to change Medicaid and Medicare?
In all of the plans for repeal and replace Obamacare, what they wanted to do with Medicaid is they'd like to get rid of the expansion under the ACA. Remember, many of the people that got insurance under the ACA got it through the expansion of Medicaid, where the federal government paid a lot more. So even some Republican governors like John Kasich of Ohio expanded Medicaid. They're worried about the expense of Medicaid, and their big thing is block grants. They'd like to have a block grant so that the amount of money that the federal government pays for Medicaid is fixed and get rid of Medicaid expansion. As we said, Paul Ryan would like to change Medicare and try to encourage people to get off of traditional Medicare and go to private insurance by having a premium subsidy or a voucher system. And what that would do is give you money. Everybody on Medicare would give them money to buy a private plan. They would probably try to phase out traditional Medicare. Remember, right now, Medicare has to pay for everything that is put through the Medicare system. If you had a voucher system, it would allow the federal government to know how much money they were spending. The problem with that is that it probably would cut benefits for seniors, and seniors vote a lot, and the AARP would definitely be opposed to that, and it'd be difficult to get that passed. I think we're just about 30, so.
Yeah, that's all the questions and all the time we have for today. So thank you very much, Kent. We really appreciate your insight into this very topical issue that we're all dealing with. We will be sending out the link to for the recording to all attendees. So you can expect to receive that in the next day or so. And we welcome you to get in contact with Dr. Bottles once you receive this information. And thank you very much. Again, right here, if you're interested in having him speak at your organization, you can get in contact with us at info@tldgroupinc.com. Thank you very much for your time today and have a great Thursday. Bye-bye.